Hello, my name is Dr. Gabriel Schifman. I am the medical director here at Overland Park Regional Medical Center, Pediatric Emergency Department. I'm here to talk to you about proper ways of getting tested for the COVID virus. As the kids are returning back to school and the fall is quickly approaching in the season, there's a lot of questions of if my child or if you yourself have symptoms and you're concerned about COVID, where do you go to get tested? I want to first start by saying that the most important thing to note is that if you are asymptomatic or you are feeling well, the place not to go to is the emergency department. Right now, with the surge in COVID and other viral infections and other injuries in general, the emergency departments have become very, very busy, and we are using all of our resources to take care of those people. So if you do not have symptoms that are concerning, if you don't have any difficulty breathing or high fevers, the best way to get tested are other facilities other than the emergency department. There are 4 places that I'd recommend you start to get tested. The first, if you have any concerns that your child may be sick, is call your pediatrician. A lot of them will give you advice, recommendations on what to do for that child themselves, but also they have a lot of testing opportunities in the pediatric offices themselves. That's number 1. Number 2, most pharmacies around the city also have setups that you can schedule online or just walk in themselves and get COVID testing. The turnaround is pretty quick. It can be a few hours or up to 2 days. You can do drive-through clinics that a lot of hospitals and facilities have started as well. We have one here at OPR. Your pediatrician would call ahead and schedule an appointment. We would then do an outpatient COVID swab for you through our drive-through that's set up in our Circle Drive up front, and those tests come back pretty quickly as well. Other options would be doing this at home. So you can go to CVS, Walgreens, Target, Walmart. They all sell home testing kits, and this is another way of kind of doing this within the privacy of your own home. It's less invasive because you're not going out into the public, and then those test results are usually within a few minutes. So having those 4 abilities to get tested and know your status is important to know. I think that if you are concerned that your child may have COVID and you are performing a test, the best thing to do until you get the result of negative is to quarantine. It is to stay home. If you're concerned, you don't want to be out waiting on a result and spreading perhaps the COVID virus to other people in the community. So I think those are the best options to think about. Now, if your child does become positive with COVID virus, it is important to come up with a plan of how to take care of that child. Definitely quarantining the child, definitely staying home from school and limiting any exposures to the outside world. It is best that a parent or a caregiver that will take care of this kid is vaccinated. Having the vaccine is the most important way of preventing serious illness, hospitalization, and death for both adults and children. So, those are kind of the top ways of getting testing in the community. Just kind of make sure that you are taking all the precautions to stay safe through the fall and into the winter months. Washing hands, keeping your social distancing, wearing masks. And of course, if you are eligible for a vaccine, which is right now everyone 12 and older, please get your vaccine. That is the best way to prevent the spread and the consequences of the disease.